Hi, everyone. It's Forrest. I hope that each of you had a wonderful Thanksgiving holiday with your friends and family. You probably noticed that we took last week off to do exactly the same thing. But we are back with another episode of 1000 Seconds, and I could not be more excited for you to meet today's guest, Dr. Raegan McDonald-Mosley. Raegan is currently the CEO of Power to Decide, where she and her colleagues work every day to ensure that everyone, no matter who they are or where they live, has control over their bodies and can decide if, when, and under what circumstances to get pregnant and have a child. Before we get started, two things that are important to note. The first is that I am a proud and longtime board member of Power to Decide. And the second thing is that Raegan and I did have this conversation prior to the election. And while the outcome of the election wouldn't have changed the content of this episode, it is more than fair to acknowledge that the work that Power to Decide does just got a lot harder. But after you meet Raegan, I think you'll see why I'm confident that she and her team are up to the task. Let's dive in. Dr. Raegan, how are you? So nice to see you.
I'm doing great. Thank you so much for having me.
It has been far too long since we've been together, even virtually, but certainly in person. It's fun to be connected, and I'm looking forward to this conversation.
Likewise.
Let's do just a little bit of bio stuff, just in case everyone isn't as familiar with you as I am. I've got my notes here, so apologies for reading, but I don't want to miss anything. Currently the CEO at Power to Decide. We'll have plenty of time to talk about who the organization is and what they do, but want to focus on you just for a bit here. So your background, as I know it, sits at the intersection of women's reproductive health, public health, international health, reproductive rights, justice, equity, sort of all in some big Venn diagram with Raegan sitting in the center. Is that fair?
That was perfect. Well done.
Good. I like it. I like it. Board certified OBGYN, education and training, undergrad at Chapel Hill, medical school at Penn, master's in public health from Johns Hopkins. I mean, these were all safety schools, I assume. I mean, holy smokes. Geez.
I'm blessed. What can I say?
mean, oh, wow. Let's see. Spent some time at Planned Parenthood of Maryland, also Planned Parenthood Federation of America. You were the chief medical officer at both of those organizations. Now, as I said, CEO at Power to Decide. We're 4 years-ish. Is that right?
It'll be 3 years in January.
Oh, 3 years in January. Okay. We both share a connection to the Aspen Global Leadership Network. You are part of the Health Innovators Fellowship. I'm part of the Liberty Fellowship, but that, in fact, is not where we first met. I've asked all of our guests, do you remember sort of in this career path and such where we first met? I suspect you do.
I think so. If I remember correctly, you were on the search committee.
I think that's right.
When I was, applying for the role at Power to Decide. So you were interviewing me.
I think that's right. That was the I'll extend a secondary challenge here. So that was true. That would have been 2020-ish, late 2020.
Yeah. So actually I lied. I will be at Power to Decide 4 years in January.
4 years. Okay. I was closer than
all
I
those
thought
degrees and can't do like basic addition.
Listen, I get it. No. That's fine. But so late 2020, which was obviously height of COVID. So we did most, if not all, I think, of the sort of interview and search process over Zoom.
That's correct.
So then first time we met in person, secondary challenge here, you get bonus points. Do you remember this?
You came to the board meeting last year.
Yes, board
first time
meeting.
In person.
I think what was it, the night before or night of, we had an event and honored some of the historical founders and key players of the organization as part of the Contraceptive Access Initiative.
That's right. A part of our Contraceptive Equity Initiative. That's exactly right.
Yeah. I love it. Okay. Got that all out of the way. One of the interesting things for me, and again, we've known each other a handful of years here, but as I was thinking about and putting together notes for this episode, doing some prep work, one of the things I notice, and frankly, this has been a bit of a constant theme across many of our guests, is what at least appears to be a sort of intentional progression through a career.
Mhm.
right? In terms of education and professional experience. And, if every step wasn't intentional, at least sort of scaffolding or building on each other, right? That got us from point A to point B. But what I notice about you, in addition to that intentionality, is, an entire career focused on all of those things we talked about: reproductive health and public health and all these sorts of things, and spent time as a practicing clinician, right? In practice and in community. Was there a point in time for you that you knew, like, this is it? This is what I'm meant to do. It's med school, it's reproductive health, it's all of these things. Like, when did that all come together for you?
I love that question. I mean, I think there are two pivotal moments that I can speak to. And the first one was very early on, actually, that
Okay.
put me on this trajectory in the first place. As you mentioned, I went to UNC Chapel Hill, go Heels, and I had the amazing opportunity to spend the fall semester of my senior year actually out of the country
Okay.
in Moshi, Tanzania, which is right at the base of Mount Kilimanjaro. Imagine waking up every morning and seeing Mount Kilimanjaro snow-capped
Wow.
off in the
Yeah,
distance,
yeah, yeah.
walking across the field to the hospital. And I worked at the community health department studying the causes of maternal mortality. Now, I'm a young college student and, had sort of hypothesized that maybe lack of access to transfusions and hemorrhage or preeclampsia or even complications of HIV, which was very
Yeah.
prevalent at the time, were the causes. But I was wrong. And in fact, the leading cause of death for this entire region of Tanzania um, was due to lack of access to comprehensive reproductive health services.
Mm, mm.
So most of my work there was just like poring over dusty hospital records, but I also had the opportunity, unfortunately, to see a couple of women come into the hospital near death or dying from unsafe abortion while I was there. And you can imagine, as a young person, that this was completely transformative and really imprinted on me. So I returned back to the States and made a strong pivot. I was thinking at that point of becoming a professor of African studies, and I was like, no, I really want to go into health and address these issues. So I
Got
went
it.
off to medical school and,
Did
had
med
this
school before
circuitous
the
route.
MPH, right? Am I
I
remembering that
did,
correctly? Okay.
correct. Yeah. I went to medical school and thought I would focus on global health for my career and went back and forth to the continent many times, worked in Senegal, worked back in Tanzania, Uganda, and did a little bit of work in El Salvador.
Oh, wow.
But during my fellowship in family planning at Johns Hopkins, I had the opportunity to work in Baltimore, where I saw the real struggles that people in my own community, the community I
Yeah.
was living in and
Yeah,
raising my
we
children
don't
had,
have to travel to other countries to see some of these struggles, right? Yeah.
that part. And that was also extremely eye-opening. The other really pivotal moment for me was finding my voice as a physician advocate, right?
Mm.
So I had all of this training in public health and all of this training in doctoring and taking care of people, but then realizing that like a lot of real change happens at the policy level.
Yeah, yeah.
And that opportunity presented fairly early on for me also in my fellowship, where there was a bill in Baltimore City, so hyper local where I live, that was a truth in advertising bill that would require crisis pregnancy centers, which are all over Baltimore City and frankly all over our country,
Mhm.
to just post something in their waiting room to say, we do not provide comprehensive reproductive health services, we don't provide birth control, and we don't provide referrals for abortion care, period.
Mhm.
And I stood up and spoke about, what it was like for patients who had landed in crisis pregnancy centers and didn't realize what they were landing in and the
Mm.
types of misinformation and lies that they were being fed and the implications for their health in the long run. And that bill passed. Ultimately, it was
Oh,
overturned,
wow.
but it felt so meaningful to
Nice to
to
come out
to
of the
be a part
gates
of
with a
it.
win, though, right? Especially
Exactly.
early in career like that.
Exactly.
It's interesting. I mean, I feel like I probably should have, or do, or did know all that. I may have forgotten a few pieces along the way. The common thread that I suspect is going to come up a lot in this conversation, though, is that misinformation piece,
Yeah.
right? And so it's interesting that that was sort of a crucible moment for you. And fast forward however many years it's been on this career journey, right? And it's like we're still dealing with the impacts of misinformation at all sorts of levels in community and social media and et cetera, et cetera. That's fair.
Yeah, and I actually hadn't really connected the dots in such a meaningful way. So thank you for doing that for me, Forrest.
Well,
But that's right. I think
it's all the studying and prep work and reading I did. Like, you're gonna go. you're gonna come across your LinkedIn profile. It's gonna say like Forrest has visited 42 times in the last 3 days. You'll be like, what is Forrest doing hanging around my LinkedIn profile?
Welcome to 1000 Seconds, a video series presented by 1000 Feathers and hosted by the firm's co-founder and president, Forrest Alton. In this first season, Forrest sits down with changemakers, leaders, and visionaries who are doing transformative work at the local, state, and national level. This series will give you a unique view and front row seat to bold and courageous conversations with people that Forrest has learned from and worked with along the way. So set your timers, 1000 Seconds starts now.
All right, so the clock is officially ticking. We have 16 minutes to get to 16 hours of content here. So I'm going to just fire off some questions. We'll see where the conversation goes. We talked a little bit about you already. I love your story, your background, your career journey, but let's dive in a little bit into Power to Decide. And I want to start just sort of with the organization's vision statement, I think is probably the technical term. And by the way, as part disclaimer and part connective tissue here with Raegan and I serve on the board of Power to Decide, the organization where Raegan is the CEO. I've been on that board for goodness, a long time. I'll pause the clock here while I think about that. I think, and this is going to play into the history, I might be the only board member now that has been through all 3.5 name changes and 3 different CEOs.
Wow.
I think I might be the only one left.
That's a testament to your longevity.
Well,
And
I
thank
don't
you
know.
for
It's
your
a testament to
service.
something. About time to kick me off that group, I think. But no, so again, just in full disclosure, so I say we, when I refer to Power to Decide, we have a vision or envision a world where everyone, no matter who they are or where they live, has control over their bodies and can decide if, when, and under what circumstances to get pregnant and have a child. How'd I do? I did cheat a little bit.
Amazing.
I did read just a touch. I love that vision statement, first of all. Second of all, as is inherent in most organization vision statements, the implication is that's our vision of a future that doesn't currently exist, right? So at first, sort of confirm my assumption that that's not the condition we're currently living in.
Unfortunately,
a world where everyone, no matter who they are or where they live, has control over their bodies, etc. That's not the current condition, one. And two, sort of why is that, right? What are the factors that are contributing to this?
Yeah. So it is absolutely not the case now, unfortunately. Okay. That is the utopia that we were striving to achieve. The reality right now is that in our country, right, we have no baseline standards for sexual and reproductive health information and education. We're in a nation where someone's access to abortion and to some extent birth control largely depends on where they just happen to live, where they happen to live and work, right? And what income bracket they happen to be in. That really dictates their access to sexual and reproductive health services, which is unconscionable. At the same time, we also have some of the highest rates and growing of sexually transmitted infections. We have the highest rates of maternal mortality for everyone, but especially for Black women, who are 2 to 3 times more likely to die from pregnancy and childbirth-related causes. Our current situation is that abortion is banned or highly restricted in half of the country. And given this milieu, we have to do everything possible to surmount these enormous barriers. But here's the good news, right? Technology is a powerful tool. Our research has shown that 97 to 98% of young people have a smartphone, and we can reach people more.
Seems low to me.
You think so? I know, we're all walking around with our faces in these devices. So it's not all doom and gloom. Yes, the current situation is far from the utopia, but that's exactly why we need to be leaning into this work and democratizing access to information.
I love it. So that probably is, at least in part, the description of what Power to Decide is, what Power to Decide does. I mean, what's the elevator pitch for the organization? I certainly should know this, but just for everybody's benefit.
Yeah, our mission is to advance sexual and reproductive well-being for all. And we do that in a number of ways. What we're known for most is our innovative digital tools like Bedsider, which is our birth control network. We just updated our Method Explorer, which allows people to compare different methods. And we also have a clinic finder where people can then connect to care and services when they want to take the next step. The other strategic intention that we have is to improve access to care, right? So that's the policy work that we're doing. That is the work that we're doing to increase access to quality services in people's own community through convenings and culture change work. And then our last strategic intention is to change the culture around sexual and reproductive well-being, recognizing that undergirding all of these restrictions is stigma, right? And so if we combat stigma and just normalize conversations about sexual and reproductive health topics, that takes away the lever to restrict access.
Yeah.
And we do that in a number of really fun ways, including through social media and our pop culture integrations, working behind the scenes with television shows, which is one of the really lesser known but really fun parts of my job.
Yeah, it really, as a board member and as somebody connected to the organization for a number of years, it really is one of the like fun, cool parts of this work, right? But also has a very sort of technical place in the overall strategy, right? One of these strategic intentions, and I really picked up on the culture change part, which you referenced a couple times. I mean, yes, there are policy implications. Yes, there are sort of federal, state, again, decisions that are being made about restricting access, but a lot of this work and conversation is about stigma and culture change, right? And that sort of has spanned multiple different presidencies, whoever's in the White House, whoever's in control of Congress, right? The one of the constant threads has been this stigma or unwillingness culturally for us to just really lean into these conversations.
That's exactly right. Again, I think it's really necessary for us to combat the stigma and to not let it go unchecked, because we know that sexual and reproductive health and well-being is an essential part of someone's overall well-being.
Yeah.
But if we don't check people when, they're stigmatizing or restricting access to abortion and contraception, then it allows the perception that these things are bad or shouldn't be talked about or shouldn't be accessed to propagate, right? And
Yeah.
so one of the things that we do every November is the Thanks Birth Control campaign, where we literally take over and smash the internet and go viral on social media with just normalizing conversations about birth control and how it has transformed people's lives. We have everyday people saying like, birth control has allowed me to finish school. Birth control has allowed me to regulate my period so that I don't, miss 3 days of school every month.
Yeah.
All the way up to, to policymakers like Hillary Clinton, who generally participates every year and talks about what birth control has meant on a population level. So it's super, super exciting.
Yeah, it's a fun event, and then the recap and lead up to it is always fun to see. Again, centering sort of on the organization, I can't believe that Power to Decide is about to turn 30.
Wow. What does that say about you, Forrest, since you
I
said
don't
you've been
know.
there
I
since
don't
the
want to say
beginning?
anything about me right now. When I came onto the board of the organization, I was like the young kid, like, oh, wow, he's a lot younger than all of our other board members. I was in the room, like, what am I doing here? All of these like long tenured, like really distinguished career professionals and me in the boardroom. And now I'm like the old curmudgeon all of a sudden. Like, what happened? Like, how did that happen to me so quickly?
Time.
Anyway, yeah, the organization's about to turn 30. I mean, again, massive following you have right now, social media and otherwise, but some people may not realize like the history of the organization goes all the way back to a President Clinton State of the Union address, right?
That's
And
right.
the
Yep.
origins of the organization were centered solely on the prevention of teen pregnancy. That was the organization's first name, the national campaign to prevent teen pregnancy. We alluded to this earlier, though, but the organization has gone through sort of multiple name changes, again, very intentional and sequential over time to meet needs. Has had multiple directors. I mean, I say that to say you as a leader, Raegan, like you walked into a situation 4 years ago, an organization that had 25 years of history and really successful history too, right? By the way, we weren't in a rebuild, we weren't in a firestorm. This was a great to greater sort of conversation. How have you as a leader been able to grab onto parts of the history and stay grounded in who we are while also sort of looking towards the future and understanding the world is much different today than it was 30 years ago. The challenges are different. The opportunities are different. right? So we can't do the same thing we always did, but we have to remember who we were, right? Unpack all that for me. Help me figure out as a leader how we work our way through all that.
Yeah, and just acknowledge I'm so lucky to be leading this organization in this moment.
Mm.
And
We
you're
are
right,
lucky
like
to have you.
so much has changed, right? Like
Yeah.
think of any major social movement and sort of the language that we use changes, how we do our work changes, our awareness about the implications on the populations that we aim to serve changes.
Yeah.
And that is also true of the sexual and reproductive health rights and justice movements, and certainly true of Power to Decide. I love our mission to advance reproductive well-being for all, and I love our focus on democratizing access to information and culture change. And we have a commitment to being a learning organization and listening to people and communities and our end
I love
users.
that.
And none of this would be possible without the organization's founders, right? And its leaders before me and the incredible team who set this path to where we are today. And some things that we do now are completely different from the origins of the national campaign. Again, so much has changed about sexual and reproductive health in writ large in positive ways. We have recognized the negative impacts and harm that was caused by the language that was used, often to shame teen moms and focus on pushing young people to certain methods of birth control, just in the movement overall.
Yeah.
And we take a much more person-centered approach now that centers people's autonomy and self-efficacy. We focus on the systems, right? Like it doesn't make sense to point to people and say like, you shouldn't be having children until we think you're ready, rather than to focus on the systems that sort of create situations where it can be hard for people to prioritize their sexual and reproductive well-being, racism, poverty, inadequate access to health information and services, right? All of those things.
Yeah.
And so we're taking a much more systems-based approach and focusing on the reproductive well-being framework, which is really powerful.
I love all of that. And especially your observation again as the leader of this organization that we can do both of those things simultaneously. And frankly, you know, I could start naming names and then would forget somebody and get in trouble, so I won't name names. But
don't do that.
the founders of the organization, again, at least from my seat, also do deserve a ton of credit, not just for what they did 30 years ago, but even for what they're doing now.
Absolutely.
Right. And to your credit, you have found a way to stay connected to that sort of founding group, find ways for them to plug in. But there's also things, to your point, that the organization's doing that's new, where they might be like, I don't have any idea what that is or why we're doing that, but go do it. Go be great at it. But these other things that are familiar to me, like let me lean in, let me support you, let me continue to lend my voice, like that's really, really cool for all the conversations our sector has about founder syndrome and difficulty with transitions. Something good in that way is happening at Power to Decide. I hope that I'm not crazy in observing that incorrectly.
No, you mentioned the first time we met in person at the top of the hour was at our Contraceptive Equity Initiative event where we were celebrating that initiative. And that initiative was made possible by the founders of the organization, Sarah Brown and Isabel Sawhill, because they sat down with me and said, like, what are you working on? What do you need funding for? How can you help? Right. And so then it's my job to sort of sell the vision of sort of the direction that we're moving in and to find that common ground of sexual and reproductive well-being for all, and wanting to make sure that we're supporting people's ability to have autonomy and decide, you know, when and whether to have children. And so I'm grateful to be able to sort of build that bridge and find that common ground. And I feel like we need to have more of those conversations across generations, across time, across political parties in our nation.
It's really interesting. I mean, as again, a longtime board member, it warms my heart to see that connectivity. But as somebody that spends a lot of time in the sector, in boardrooms, in executive transitions, in organizational growth type conversations. Side note, maybe not for today, but you and I and whoever else should really write this up, because the sector writ large really struggles with transition and generational connectivity and organizational growth without sort of leaving everyone else behind, right? I mean, we could frame this a lot of different ways. So I'm going to put a pin in that, quite literally. Sorry for the consultant speak, and come back to. I'm going to challenge us to follow up on that in some way.
I would love to, honestly.
I love it. I love it. But before we do that, I want to go to this idea of sort of also charting your own path, right? And the
Mhm.
organization, again, on a very sort of intentional trajectory over the last almost 30 years. A couple things that you have mentioned already, the organization's intersection and impact and work with MTV in Hollywood, right? With shows and such. That is sort of extended and expanded into Thanks Birth Control, where we don't only take over social media, you also have billboards and maybe even your face, or is it just billboards in Times Square? What's up all over the place?
Not my face in Times Square. Oh goodness, no. But yes,
Just
billboards.
billboards. But then you specifically, also maybe with the help of some on your team, have rolled out a whole effort and hashtag Ask Dr. Raegan, which has really sort of blown up. Like, put all this stuff together, MTV and LA and Times Square, and now your own hashtag. Like, am I supposed to refer to you as an influencer now?
I hope not. When I went to medical school, I never thought I'd be, going viral on TikTok, but here we are.
Yeah,
But of course, TikTok didn't exist when I went to medical school. And so,
fair.
it's incumbent upon us to figure out how to reach people where they are, right? So you mentioned
Yeah,
our pop culture integrations, the work that we've done over decades with MTV. We're shaping messages and reaching people where they're spending a lot of time. And that is,
yeah.
watching television, that is watching film, that's also increasingly scrolling through TikTok. So how
Yeah,
can
that's
we
right.
flood those spaces with evidence-based information? Also, our research has shown, we just completed a national survey that showed that 80% of young people said that they would prefer to receive information about contraception and an abortion from providers,
Mm,
but only 33% in the last year said that they received information about contraception from a provider, and only 3% said that they received information about abortion from providers, right? So there's
wow.
this huge gap, right, between
Yeah.
where people want to get information and where they are getting information, which is increasingly in the digital space. And we have this unique opportunity to do both, to be in the digital space, but also with a provider voice, giving evidence-informed, accessible information that's hopefully also a little bit fun. And so that's what's allowed us to go viral on TikTok with little simple videos about how birth control works. What happens if you throw up your birth control? What is monkeypox? How long does an abortion take? And it's just been a really great opportunity to meet people where they're spending a lot of time
Yeah.
and, may need this information even if they're not fully aware of it.
That it really is another sort of perfect example of maintaining our core, right? I mean, we started this conversation with like combating misinformation, but extending that and taking some risks even, and sort of getting involved in these big places and spaces on social media and traditional media and MTV and Hollywood. Like, maybe you wouldn't necessarily think of that as a frontline strategy, but as you said, here we are. I know that's a big part of Power to Decide's current work and future work. We've got just a minute or so left, though. Anything else we should know about in terms of like big initiatives or challenges on the horizon that you're thinking about as it connects to this conversation?
Well, Forrest, I mean, it's so fun to be a part of a learning organization, right? Where we
Yeah.
get to sort of stay true to our core of sort of like, how do we use pop culture integrations? How do we meet people where they are? How do we use research to inform the
Mhm.
gaps? And we have an amazing opportunity to do this at a very deep level with an investment that we've recently received to help us figure out how to optimize and strengthen our digital tools, right? So
Mm.
right now I'm recording these fun videos and putting them out there and seeing what happens. Some of these videos get a couple of views, and some of them go completely viral with over 1 million views. And so this will allow us to do the research to figure out why, right? Like, what are the right messages? What are the right messengers? Perhaps it's not me for everyone.
Mhm.
Where do we reach people? What time of day should we be posting them? On what platforms? And so we have this incredible investment to sort of test and learn and go back to our roots of sort of being a research-informed organization to reach people and advance their sexual and reproductive well-being.
Oh, that's awesome. That is just so cool. And by the way, I hadn't really thought about this before the episode, but can you help us make 1,000 seconds go viral while we're out there? Like, I hope you're going to share this and send it around for us and all those things. We got to
That's our
wrap up,
goal.
but before we go, just a quick sort of shameless self promotion here. Where do people go for more information or to follow you on socials, that sort of thing? Anything you want to shout out, the website and such?
Yes, thank you for the opportunity. Please check us out at powertodecide.org. Follow us on Bedsider and all social media channels, and definitely check out our TikTok page, including our hashtag Ask Dr. Raegan series.
I love it. Raegan, thank you so much. So fun to sit down with you. 16 minutes is way too short for us, but a great conversation. Thanks for being a great guest.
Thank you for the opportunity.
See you soon.